Mr. Shapps, we're told that Omicron is everywhere, yet all of a sudden we're seeing a lot of these rules being removed. Are we not letting down our defences a little bit too early?
No, definitely not. This was always brought in on a temporary basis, and it did its job. We, since bringing in the red list and then these additional tests, managed to get 13 million extra jabs, the booster jab in people's arms. So it served a purpose. Obviously, Omicron is global, it's worldwide, everybody has it now. The proportion that comes in from overseas is completely, is minuscule by comparison with the numbers that are actually here. So it's now widespread. And in a sense, Omicron testing has outlived its usefulness, so we're able to withdraw it from international travel today.
So that's
domestically,
Omicron.
of course, can carry on testing.
Sorry to agree, but that's Omicron. What about other variants? By doing this, we are potentially letting loads of other variants in without testing people before they come to the UK.
Well, because it's global, we're just as likely to perhaps have a variant here. We saw that last year, or the year before now, with the Kent variant, also called Alpha. So, of course, a variant can occur anywhere. This country does do more genomic sequencing. That's when you find out what the variant might be than any other country in the world. So we're still carrying on that massive sequencing program. We'll carry on doing that because if you get a positive lateral flow test after you've travelled, and that is the one test that remains, you must take a lateral flow test by day 2. And if you do get a positive, then that needs to be PCR'd on the NHS and sequenced. So we've still got that protection in place, but we think this is proportionate. A lot of jobs depend on travel, a lot of jobs depend on tourism, and we need to keep these measures in line with actually what's going on with Omicron around the world, which it is everywhere now. It's the predominant strain of coronavirus.
Not everyone's convinced either. The Welsh Government Health Minister said that she was making the changes reluctantly and stressed that the Welsh Government was still advising against all but essential international travel. Why do you think they're not concerned?
Yeah, look, it's always been for the different devolved administrations around the UK to decide. As far as I'm aware, actually, the whole of the UK is going to be moving on this together. So these rules will apply everywhere. And these are judgment calls. It's absolutely right to say. But I do have to say, the idea that somehow the United Kingdom is safe and secure, but if you travel outside of our borders, then somehow it will be it's a dangerous world out there. I think sort of belies the truth, which is that Omicron is everywhere around the world. We've got very significant testing in place, and I don't think any country does more testing than we do per head of population. So, for example, on Tuesday this week, I saw there were over 2 million coronavirus tests which took place, and so we keep a very, very close eye on these things, but people still need to be able to get around and see family, perhaps elsewhere in the world. Business needs to be done elsewhere. And as I say, we have pretty high levels of coronavirus here. So it's not like if you go abroad, you're necessarily going somewhere with higher levels. You may well be somewhere with lower levels. So we just didn't see the reason to keep what were always temporary measures in place for a moment longer than was useful. And in a sense, they just outlived their usefulness when it comes to international travel.
Do we have a shortage of tests?
No, we don't.
Because a number of spokesman yesterday said that changes were to make the best use of our testing system at a time of high prevalence. Slightly suggests that there's a certain amount of prioritising.
Yeah, no, that was specifically in reference to not requiring to do a PCR test. If you're asymptomatic and you take a lateral flow, you no longer need to confirm that with a PCR test. So that was in reference to something slightly different. And yes, it is true to say that we want to make sure that we're focusing those tests on critical workers on the front line, as for example, with transport workers or with health workers, to make sure they're available. So we don't want to over-test for no reason. But remember, the travel tests were always provided by the private sector, and that single lateral flow that's still required will still be a private sector test. But we've got a huge amount of testing available. As I mentioned, we tested 2 million in a single day on Tuesday, and there are tests available for people who need to get PCR tests. Lateral flow supply is very much available. Sometimes delivery of those tests is proving challenging, and we're increasing the number of delivery routes available through the Royal Mail and elsewhere as well.
Could you just clarify the rules on testing for us? The advice seems to be that if you have one of the three main symptoms, that you should get a PCR, otherwise not. Now, this is confusing quite a lot of people because a lot of people with Omicron have aches and pains and not necessarily a temperature and a cough. Should they just do a lateral flow test?
Yeah, that's right. So just to clarify this, if you have one of the main symptoms that they're listed on the NHS website, then by all means book a PCR test. For other people who are perhaps going about their normal lives but maybe feel they'll be in a position where they'll meet vulnerable people, that's where the lateral flow tests are available. I know a lot of people over Christmas, myself included, taking lateral flow tests before going to see my elderly parents, and that's good practice and it helps to protect everyone. In fact, in my family, my eldest son took a test, had absolutely no symptoms whatsoever, and found he was positive, and then had to go and self-isolate for 9 days until he got 2 days of negative lateral flow tests. So that's the purpose of lateral flow tests, particularly good where people are asymptomatic, and it can find people who've got cases. But PCR tests where you are symptomatic, that's the message.
And it seems to me that the current message from the government generally seems to be that we are just going to have to live with COVID. As you were saying, it's not the case that there's a big bad world out there. We have a lot of it in the country. But there's a lot of messages coming from the NHS, from staff, and we have this report out today about pressure on the NHS. And they feel that actually living with it is just not possible, that we are reaching a crisis point in the NHS. What do you say to that?
We've always known in dealing with Omicron, and this is where our plan B has been in place, that we are, if you like, always trying to find the right compromise between going too tight on restrictions, lockdowns, and let's face it, they have a lot of costs connected, monetary costs, obviously, to the economy, but also to people's jobs, also to people's mental health of these lockdowns. And then again, not wanting our hospitals to be overrun. And this is where I think the Plan B has been shown to be the right approach so far. We know that
But we've got 20 hospitals with critical warnings at the moment. That doesn't seem to be like it's going swimmingly for them.
Yeah, so there are 137 trusts. There are 24 which are critical. It's not entirely unusual for hospitals to go critical over the winter, often with things like the flu pandemic, but there are very real pressures, which I absolutely recognise. And we know what it's like when these hospitals are under pressure. My dad was in hospital this time last year when there were 40,000 people in hospital with coronavirus, and the pressures are very real. This year, we've got 5,000 more doctors, 10,000 more nurses in place, and it's very important that we do provide all those resources. And we've provided an extra £5.9 billion to hospitals, a £36 billion catch-up programme as well. But I do absolutely recognise those pressures. As I say, what we want to do is steer the country through the Omicron wave. And I think so far Plan B has shown to have been the right way forward, not shutting down the whole country yet again with all the costs to people's mental health and elsewhere, but making sure that we're providing the extra resources to hospitals. Unfortunately,
in terms of those extra resources,
it is less severe.
In terms of those extra resources, a report out from MPs today saying that NHS waiting lists, which are already huge, are to double by 2025. Huge numbers in the North East especially. What is your solution to that?
Yeah, I mentioned the amount of money that we're putting into tackling those waiting lists. So we've got a 5.9 billion catch-up, the 36 billion that I mentioned. It's one of the reasons why we took what most people would accept was a difficult decision, but nonetheless, I think worthwhile one last year, which is to say that we will be having that national insurance rise in order to pay in part for catch-up on the number of operations and routine procedures, which, because we've now been tackling coronavirus for, nearly 2 years, have by necessity in some cases not been able to take place. We want to make sure that we catch up with that. We're putting record sums into our NHS. We love the NHS. We want it to be able to function. I think most people watching a programme accept that, of course, these have been exceptional times. We've never faced anything like a virus like this before in modern history.
Yeah, and in terms of support in the cabinet, Jacob Rees-Mogg not quite as in favour of the national insurance rise as others. We understand from yesterday's cabinet meeting. How did his suggestion that should be scrapped, the rise, go down?
Well, cabinets take place in private, so I'm not going to get into commenting on cabinet meeting content. We have a plan. It is to catch up on things like the backlog in NHS care, which has come about, unfortunately, through coronavirus, and that plan is being put into place. It is also true to say that we want to make sure that we relieve tax pressures on public as and when we can, but that has to be done in line with.
The government could change their mind on this and scrap it.
Well, look, we're absolutely committed to doing two things. One, catching up with the backlog in the NHS, and that's why we have this national insurance increase specifically for that purpose. And two, sorting out the long-term issue of social care, where people lose their homes if they have specific types of illnesses, for example, dementia, which has always seemed to me to be cruel and unfair, particularly when you're helped by the NHS if you had something else and that was eventually the thing which you passed away from. So, no, we're absolutely committed to making those changes. It's an historic change that I think will bring a lot of security to families up and down the country. So we'll certainly be doing that.
OK, Grant Shapps, good to talk to you today. Thank you for joining us.
You too. Thanks very much.